Welcome to this clinical walkthrough on a nocturnal enuresis case for UKMLA, brought to you by Medi8, your 24/7 practice partner. Okay, let's dive right into the case. Picture this. You're in a GP practice, and the father of an 8-year-old boy is sitting opposite you. He gets straight to the point. He's here asking for a prescription. So, how do you handle this? This station is all about balancing the parent's request with best clinical practice. In this explainer, I'm going to give you a step-by-step framework to confidently handle this exact scenario, from your first words right through to the follow-up.
Right, first things first, the setup. You're the FY2 doctor, and you're meeting with the father by himself. How you start this conversation is absolutely key. Your introduction has to be both clear and empathetic.
Using these exact words is a fantastic start. You're establishing who you are, you're building rapport by thanking him, and you're confirming the patient's details all in one go. It's simple, professional, and sets a positive tone. Okay, introduction's done. Now we move into the history of the presenting complaint. What you're looking for here is the pattern of the bedwetting. You need to get the full picture.
You need to ask about the frequency and the timing. The father tells you it's happening around 3 nights a week, but, and this is important, it's only at night. There are no daytime symptoms. These details immediately point you towards primary nocturnal enuresis and, of course, confirm the father's agenda.
But before you jump to conclusions, you have to screen for any red flags. You're making sure nothing more serious is going on. So you'll ask about things like daytime dribbling, pain, constipation, or any signs of diabetes like increased thirst. To make sure you cover all your bases and get a complete, systematic history, I want you to use the Bird Math mnemonic. It's a great tool to keep you on track. Let's break it down. So you'll go through each point, pay special attention to D for diet, what are his evening fluid habits like, and A for activity and sleep, is he a deep sleeper? Finally, F for family history is a big one here. You'll find out that the father had the same problem as a child, which is a fantastic point for reassurance later on. Now remember, the OSCE isn't just a test of your clinical knowledge, it's a communication exam. You absolutely must actively listen to and address the father's ideas, concerns, and expectations. You've got to explore his ice. He shares his idea. He thinks something is wrong with his son's bladder. You need to acknowledge that directly. It shows you're taking his thoughts seriously. Then he voices his concern. He's worried about the social side of things, sleepovers, embarrassment. You need to validate that. Show him you understand the impact this is having on his son and the whole family. And finally, his expectation. He states it clearly. He wants to try medication. This is the main reason he's here. Acknowledge it and let him know you'll be discussing it in the management plan. So, you've taken a great history. Now it's time to put it all together and formulate your provisional diagnosis. The diagnosis here is primary nocturnal enuresis, but you can't just say that. You have to explain what it means in simple terms that a parent can actually understand. Using this exact phrasing works brilliantly. It's clear, it's empathetic, and most importantly, it takes all the blame away from the child. This is how you reassure a worried parent effectively. All right, let's move on to the management plan. You're going to build on that reassurance you've just provided. And the key here is explaining that we follow a stepped care approach. You'll want to explain the management ladder. You'll start by talking about lifestyle changes, like fluid advice and using reward charts. Then, you'll introduce the enuresis alarm as a great long-term solution. And now, you circle back to the father's specific request. You explain that yes, desmopressin is an option for an 8-year-old. You explain how it works. It just reduces how much urine is made at night, and that it's good for short-term situations like a school trip or a sleepover. And remember, you can practice this exact case right now and get objective feedback on mymediate.com. It's one thing to hear it, but another to do it yourself. Now, this part is critical. You cannot miss this. The safety netting for desmopressin. You must state these points clearly to the parent. This is all about preventing hyponatremia, and it's a huge safety issue. To really impress the examiner and score those top marks, you need to show that you understand the nuances of age. So let's quickly compare how you'd handle this case versus a similar one with a 5-year-old. Look at this table. It shows the core differences perfectly. With a 5-year-old, the focus is almost entirely conservative, but for an 8-year-old, the approach is much more proactive. The social pressures are higher, and that makes medication a totally reasonable option to discuss. So there you have it. That's the framework. Now you can practice this exact case on mymediate.com to really perfect your approach.